You should never be satisfied with living with chronic pain. Every single person who suffers from chronic pain at some point had an acute trigger for that pain. As such, you should see a physiotherapist so they can help diagnose what the trigger was. Once the trigger is diagnosed, you will be able to work with your physiotherapist to construct a treatment plan. While you are waiting for this appointment though, you need coping strategies for the chronic pain. Here are a few daily habits you can introduce into your life to help manage and minimize any pain you are suffering from. It's quite possible that your physiotherapist will actually recommend a few of these changes as a part of your treatment. The first tip is to get an endorphin boost. Endorphins are released when you exercise, at least at a mild level. It's possible that you are suffering pain and as a result, you are not exercising. This lack of exercise could lead to a loss of muscle tone and strength, which then can make the pain worse. So mild exercise is recommended to counter this problem and also to stimulate the release of endorphins. Endorphins are the feel-good brain chemicals that lighten your mood and help to block your pain. As such, exercise should help reduce your pain immediately. The second tip is to focus on your breathing and biofeedback. It sounds obvious, but few of us actually take the time to stop what we're doing and calm our minds. Deep breathing and biofeedback are all stress management techniques that relax your body, which helps relieve the pain. It's really simple to do. Just close your eyes, focus on your breathing, and just think, breathe in, breathe out. Try it out. The third tip is to avoid alcohol. While alcohol may give you some immediate relief and even help you fall asleep, as the alcohol metabolizes, it promotes shallow sleep, reduces the important REM sleep, and may even wake you up. While you may think it's a good short-term remedy, the reality is that it will wear off and can often leave you feeling worse. Trust me, there's nothing worse than neck or back pain combined with a hangover. The fourth tip is to keep a pain journal. This is you helping your physiotherapist help you. The more we can understand about your pain, when it occurs and the intensity of it, the more we'll be able to help you. Information and feedback are important tools during the diagnosis period. A good way to do this is to write down a pain score between 1 and 10 every few hours so you can track whether the pain increases or decreases in intensity and whether there is a certain time of the day that it is at its worst. The fifth tip is to schedule relaxation into your day. By taking care of your emotional and physical health, you can better manage your pain. That may mean saying no to events like parties if you need the rest. Or it may mean scheduling a regular massage or a clinical Pilates session. How you care for you is unique to you, and it's also up to you. If you want to start living pain-free, then the decision is yours to make. Tip number 6 is to distract yourself. Focusing on the pain can just make it worse, so do something to distract your mind. It doesn't matter what it is that you do, gardening, reading, watching a movie, just do something to keep your mind active and away from thinking about the pain. These are just a few handy tips for managing chronic pain. The important points to understand is don't just mask the pain with painkillers. Really look for a solution to the root cause of the problem by first investigating the problem in detail with a physiotherapist.